Welcome to another episode of Public Health Uncoded podcast with Dr. Saroj Pachauri, brought to you by Center for Human Progress in partnership with the POP movement, where POP stands for Protect Our Planet. I'm your host, Drishya Pathak, and today we have a very special episode lined up for you. Joining us is our resident expert, the esteemed Dr. Saroj Pachauri. It is always a pleasure to have her bring her expertise of more than 60 years. And it is exciting to listen to how the public health landscape has evolved over the decades during all these conversations. Now, so this podcast is specifically focused on public health, and we have done some amazing conversations so far. You agree, right? But we haven't discussed about the professionals who work in the sector. Therefore, we had to call somebody who can talk about us, the professionals from public health. And so we have our special guest today, Quisha Umemba, a pioneering public health entrepreneur who has made remarkable strides in integrating public health with innovative business solutions. Welcome to the show, Ms. Quisha.
So nice to have this opportunity to interact with you. Welcome to this podcast. I'm so looking forward to hearing you. And I understand that you are going to talk about public health entrepreneurship, which is a very, very interesting subject. I know you've done a lot of work in this area in public health entrepreneurship. You've written a book and so on, and we learn a lot from you today. But to begin with, let me ask you, how did you start working in this area? What is it that drove you, and what is your concept of public health entrepreneurship? Can you explain that, please, Quisha?
Absolutely. Well, thank you, first of all, for having me on the podcast. It's a pleasure to be here with you and your team. And yes, I've been a public health entrepreneur for a little bit over 4 years now. It's nothing I ever imagined that I would do when I was working at the bedside, taking care of patients. I'm a registered nurse. I realized after getting my bachelor's in nursing that I didn't need a third nursing degree. I had an associate's, I had a bachelor's. And one of my good friends, who's also an endocrinologist and happened to be my supervisor at the time, said, she said, you should probably look into getting an MPH. And I said, what is an MPH? I said, I see it behind doctors' names all the time, MD, MPH, MD, MPH, but I have no idea what it is. And so she's the first person that introduced me to it. I researched it a little bit and came to find out that I love it, and it marries perfectly with my nursing degree. I always like to share a story that we did in my nursing program for my bachelor's, where we completed what's called a windshield assessment, where we drove around the neighborhood and made notations of anything that really was a public health related issue. And it was my first time realizing everything from, oh, there's no bus stops out here. Oh, we're in a food desert because we're in a new rural community. Oh, there's no park benches. Dogs are running around on leashes, all of those things. And so that was really the first time that I got introduced to public health. Again, even when I left the bedside and went to go work for the Houston Health Department, which is tied probably for third largest city in the U.S., I had no idea that entrepreneurship was even an issue. I knew what I did every day. I love what I did every day. And probably right about the third year mark of working as a chief nurse in the Office of Chronic Disease and Prevention, I realized I'm working a lot. I'm working a lot of hours. I'm overseeing 7 different funding sources and multiple staff and many initiatives, and I'm doing stakeholder development and partnership development, and I'm serving on all these boards and all these committees, and the list goes on and on and on. And that was my first time thinking, probably do this for myself, because of course, if you know anything about working for the government, you've got all of these layers of bureaucracy and red tape, and you're limited by your funding, you're limited by politics. Whatever is the priority for the administration that's in the office at that time. And so that's when I really started getting, and I wouldn't say falling out of love with public health, but getting frustrated with public health. When my community needed something or my team needed something, waiting, sometimes weeks or several months for it to go through the layers of approval just didn't sit well with me. And I started being what I call a rogue employee, right? I would just do things and then ask for forgiveness. I wouldn't ask for permission, right? Because the community needs it now. My team needs it now. And I worked that position for 4.5 years. And then I went to work as a diabetes nurse consultant with the Texas Department of State Health Services. So I went from a local health department to a state health department. And within the true role of a consultant, once I saw what being a consultant was, I said, oh, this is just providing technical assistance based on the expertise and the experience that I already have. And that's when I told my husband, I said, I think I'm going to start a business. I was bored anyway. The state is very, very, very slow. And it took me a while to really figure out where my niche was, because as a nurse and as a helping professional, we can do so many things, and there's so many skill sets that we have and that we're good at. But I decided to combine my love for education and public health and nursing. And so founded Umemba Health a little bit over 4 years ago, which is a public health workforce development consulting and training agency.
That's very interesting. So you've had a long journey from nursing to public health and then on to entrepreneurship. Now, I just want to understand, what do you mean by entrepreneurship? What is your conceptualization of entrepreneurship in public health? And what we gain by learning about it?
Oh, that's such a great question. So entrepreneurship is basically finding a solution to a problem that an organization or even an individual has. And I do tend to work with both, but primarily with organizations. And I think for a long time, people look at entrepreneurs as people that are, starting these business ventures and going after all of this venture capital and getting this, first series funding, third, all these multi-million, and they think Silicon Valley, right? They think medical devices, they think all of these kind of far-fetched ideas, or they think of some type of business or banking or creating some kind of app. And all of that is indeed entrepreneurship. But at the end of the day, being an entrepreneur, it simply means you're going to use an innovative idea to solve a problem that an organization has. And what I realized when I worked in the health department on the local level, on the state level, and even when I was a nurse at the VA, which is federal, so I've worked all of it, all I did was solve problems all day. When we developed a health education program, it was because we were solving a problem and addressing a health disparity in our community, right? And so when I realized, I solve problems all the time, whether I'm developing a PowerPoint presentation, developing a toolkit, developing a curriculum, providing a training, whatever it is, I am a natural problem solver. I also figured out I was an intrapreneur, and that's something I'd like to talk about a little bit later today too, if we can get to it. And so I started looking at it that way. Again, when I went to go work for the state as a diabetes nurse consultant, all I did was solve the problem. That at that time, one of the major tasks one of the major roles that I was tasked in helping organizations do was to convert a component of their diabetes program into the virtual space. This is pre-COVID. So it was not very well received. It was a lot of red tape. It was a lot of questions, a lot of concern, a lot of, kind of a knee-jerk reaction. What do you mean we're going to be teaching people virtually? How do we do it? What platform do we use? Does it need to be HIPAA compliant? So I had kind of a head start on the virtual learning and the Zoom teachings. And, I was showing organizations like, you can use the webcam to show a patient how to draw up their insulin or where to inject their insulin. And so I am happy that I had that head start, because lo and behold, I didn't know that, a year later it would come in handy. But ultimately, when we talk about entrepreneurship in the context of public health, you're taking the same process that you would, any entrepreneur would, and you're using it to help you come up with solutions for public health organizations, public health initiatives, etc.
Fantastic. Well, this is something that we all experience, the issue of problem solving. And problem solving is something that's part of our lives, actually, in public health. But also, when you're working in a bureaucracy, in a government system, then the layers of the bureaucracy are really intimidating. And so hold you up, they hold you up all the time, and you continually try to overcome that obstruction, so to speak. So tell me, how did you manage that? Because I know I've also worked with the government system, and I know what it's like. I worked in India. You're working in the United States, and the bureaucracies are the same the world over, I guess. The problems are the same. So how did you handle these layers of bureaucratic intimidation?
I didn't do it very well. That's why I work for myself now. Again, I found myself, doing things that I know needed to be done, and then asking for forgiveness. Like, honestly, it's one of the main reasons that I work for myself. One of the things that we're really bad about in public health, and that it's just the nature of it, because public health is primarily funded, right? Grant funded. And so it also is hard for me to accept we're going to start these programs and start these initiatives and go in these communities, and as soon as the funding is up, we're going, right? So for me, sustainability has always been a key. Like, every program I develop, okay, how are we going to get the community involved in this so they can continue the program after we've gone? And I would say that that's probably one of the main reasons that I work for myself. I just could not handle the red tape. Now, you still have to deal with it in some respects as a consultant. For one, if you do any kind of federal contracting, which I do, you're probably not going to get paid until 3 months later, right? So, there is going to be some patience. There are some things that you're going to have to deal with, but I'm on the outside now. It doesn't nearly affect me as much, and I don't have to deal with every single thing. Usually when an organization comes to me, they've already gotten the approval to hire a consultant. They already gotten the approval for the budget. So they come to me and say, hey, Quisha, we need to, help creating a workforce development plan or workforce needs assessment. So here's the budget. Here's what we need. Here's the timeline. So I already have the constraints that I'm working with, but then I have the freedom and the creative to be creative and to do whatever I need to do to get that work done. So it really serves me, my need to be creative and to be innovative and all of those things like that.
That's fantastic. And I don't blame you for having left the government's program and starting to work on your own. I too have worked on my own as well as with nonprofit organizations and done some similar kinds of work that you're talking about. And I think it's great that you're getting to this point where actually funding is available, the program is approved, and you just simply have to do the work, which is what you want to do. This is fantastic. So tell me more about your work.
Absolutely. So with workforce development, our most requested services are curriculum development. We write curriculums all day long. We write so many curriculums that we actually started licensing our own curriculum to organizations that train community health workers. So we do a lot of work with community health workers. We advise organizations on how to start their own CHW programs, whether that is for certification and training or whether it's a CHW-led initiative like a diabetes education program or stroke prevention or whatever that looks like. We do a lot of toolkit development, resource development, a lot of speaking and training workshops. As a matter of fact, my team was in another state last week doing a half-day workshop on homelessness, compassionate care for unhoused populations. So again, because I love to teach and I love working on projects that combine my nursing background and my public health background. So I really feel like I have found the best of both worlds. It allows me to stretch myself, to still lean on my medical and my clinical background, but then also to be able to apply our interventions on a population level so that I'm, again, addressing everything that I love about public health as well.
This is fantastic, Quisha. Congratulations that you reached up to this point. It's a marvelous to hear this. And so I understand that you have written a book on entrepreneurship and public health. Can you tell me about the book, please?
Absolutely, yes. The book, we launched the book in March. It's called Public Health Entrepreneurship, Navigating the Intersection of Purpose and Profit. So probably year 2, when I started making money in my consulting business, I started talking about how good it feels to be able to make impact and income. And one of the things that we don't talk about is helping professionals, and that's how I group everybody together, public health, nursing, social work, whatever, is we tend to downplay our expertise and our experience. And for those of us that are new into entrepreneurship, it can be very hard for us to charge our worth. It's very hard to charge for things that come naturally to you. It's very hard to charge for things that you've done for free for years. And if you are working, especially in like the health department or the nonprofit space, it's almost an expectation that you'll volunteer your time, your talent, your expertise, your services, etc. And so for me, I started saying it's possible for us to make an income and make an impact. Now, mind you, the first 2 years of my business, I still worked full time. I actually had left the state. I went to corporate America. I worked as a a clinical trainer for a value-based care agency. And I got to the point where I was making the same amount of money in my business that I was making for my corporate job. And it was a 6-figure job. And so people started then coming to me, hey, how did you get into public health consulting? Where do I need to start? So on and so forth. I still wasn't ready to really kind of coach people. I would, share what I knew, and this is what worked, and this is what worked, and I wish I would have done this sooner, all of those different things. And then once I spent a year full-time, because it's been 2 years full-time in a couple of weeks. So I thought, man, I've learned so much in this year full-time business. It's good, it's bad, it's ugly, it's scary, it's exhilarating, it's so many different things, and you become a different person. It makes you become a different person. And some of it, all of it is good. It just is what it is. But having to lead from a place where you make business decisions that don't involve the heart, and it's all mind, it's all bottom line, but you still have to navigate not only your purpose, which is always first, you have to navigate being able to be profitable as well. And so the book talks about not only public health entrepreneurship and the state of public health consulting and what that landscape looks like and could look like in the future, but it also talks about how you navigate making sure you're making money. You're not just doing this just to have this expensive hobby, right? You're putting good out into the world. You're helping organizations with these wonderful, much needed health equity campaigns or initiatives or programs, whatever that may be. But you're also making sure you can pay your bills, you can pay your subcontractors, and your business is sustainable, because if you're not making money, you're not in business, you're not helping anyone. And so I say, I think I have more of an impact now as the CEO of my own public health consulting business, way more than I did when I was working on the floor, taking care of one patient at a time, or when I was in the health department, or when I was, at the local or state level, or even in corporate America, because I have the freedom to be able to come into an organization, have these fresh eyes, give them these perspectives and things that they've not even thought about, and come up with these wonderful campaigns that are going to reach so many people, and they'll be able to use time and time and time again. So yeah, that's how I feel about it.
Well, I think it's wonderful. I've always believed all my life that when you're doing good work and you have all answers to problems, in order for that to reach the large population of the world and to share that learning, the only way you can do it is through documentation. So you have documented your work in this book, and I congratulate you, Quisha, for it. This is wonderful. I've always said this, in fact, that it's extremely important if you want to upscale your activities, if you want to replicate your work elsewhere in different settings with different institutions, then you must document.
Yes. And I will say it's not even just my work. So I asked 3 of my colleagues to come in and write a chapter. And so I have 3 co-authors. And so I am workforce development. Dr. Spinner is a health equity consultant. Jamitra Hawkins is a community engagement consultant. And then Vanessa DaCosta, our final co-author, is a she does data visualization, data analysis, different things like that. So you get a sense, the readers get a sense of not just what I do and the groundwork and how I serve my clients, but they can see how other consultants are working, how they built their businesses, how they serve their clients as well. So I think it's the first of its kind. I know there's more public health entrepreneurship books that will come. I hope that more universities and colleges will start to take note. I'm starting to see a trend now. So we're starting to see more programs. For the longest time, and you, as a physician, you probably know, they teach physicians how to start a business. They teach pharmacists how to start a business. But they don't teach public health people how to start a business, or they don't teach nurses how to start a business. And that is one trend that I've noticed in the last several years. Nurses are starting businesses every single day. I mean, just the skill set we have, it carries us into just being creative and to finding those on-the-spot solutions. If you worked on the floor for any amount of time, you've had to come up, figure out how to do your own dressing, figure out how to do things when you're out of supplies. And so starting to see that more and more people are becoming, are going into enterprises, really, it's an exciting time.
Fantastic. Tell me, what are the key lessons that you would like to share with our audience. What do you think are the key messages that you want to give after having done all this?
Key messages. So I alluded to something earlier. It's a term that I came across when I was doing my literature review for writing my book. And it's a term called intrapreneurship. I-N-T-R-A, intrapreneurship. And essentially, intrapreneurship is an individual that acts as an entrepreneur at work. And when I was reading this, it's not a lot of literature on this term. I thought, oh my God, that was me. That was me in every position that I worked in. I've always been an entrepreneur. As a matter of fact, my staff called me the 90-day girl. We would do something in 90 days. We're measuring it. If it doesn't work, we scrap it. If it works, great, but we're going to figure out a way to make it more efficient. How can we be more productive? I had SOPs for everything. And I always had this mindset of let's make it better. Let's make it better. Let's make it better. When I was a nurse on the floor, when I worked at local health department, when I worked at the state. And so finding that and realizing that, it wasn't always easy for my leaders to supervise me because I had that type of personality. It wasn't easy for me to be just status quo, this is how we've always done it, so we're going to keep doing it. So I tended to buck the system a little bit. I tended, like I said, to do things and ask for forgiveness and not for permission. But in having this hindsight, which is what they say 2020, and seeing that this was me all along, it would have been, honestly, if I had a manager that would have been able to cultivate that, allow me to have a flexible work environment, allow me to be creative, allow me to develop programs, allow me to refine them, allow me to provide input, allow me to work more independently, I would still be working today. I would still be working because those are the things that I thrive for, that I crave for. That's why I work for myself. So I will say, if you are in a position of management, if you are, a supervisor, team leader, whatever, first of all, acknowledge the entrepreneurs in your workforce and find out how you can. They make excellent staff, but the minute they feel stifled, they're going to do the bare minimum. That's how kind of the trajectory of my career, as I was getting close to leaving the field, I just would, it's called quiet quitting, right? You don't quit, but you just kind of do the bare minimum. You don't go above and beyond. You're not working late or coming early anymore, those type of things. So that's what I'll say to organizations. To individuals, I will say just start. A lot of times people think they have to have all their ducks in a row, right? They have to have the website. They have to have the branding. They have to have you don't have to have any of that. You just need to start. You can start as a freelancer. You can reach out to your network and say, this is my skill set. I'm just looking for a couple of contracts. I want to get the experience, but nothing happens if you don't start. And do it scared. Do it messy. Do it ugly. Do it dirty. Do it scared, because you'll get better and better. When I go back and I look at the curriculums that we were writing the first year, I cringe. They're horrible. They're terrible. I'm like, oh my God, I can't believe I charge people for this. But then I look to see what I was charging. I'm like, oh, thank God I wasn't charging much back then because the quality wasn't there. And so just know that you're going to grow. You're going to get better. You're going to get more experience. And then I also will speak to new grads. A lot of new grads just getting their bachelor's in public health or just getting their master's, they want to go right into public health consulting. I personally don't recommend that. You learn a lot in your public health programs, but it is nothing like going to work in a health department. It is nothing like going to work in a nonprofit. And I have some mentees that will work with me, that I work with, and the issues that they have are they're trying to get clients, but they have no idea how to solve problems because they don't have that experience. And if you don't go and work for an organization and you come across those day-to-day, trials and tribulations, for lack of a better way to put it, you don't develop the creativity to be able to solve problems. 90% of what I do is because I did it at the health department, or I did it in corporate, or I did it at the hospital, right? So a lot of it is based off experience. Yeah, a little bit of education, but most of what I do as a consultant is based on my experience.
Thank you, Quisha. This is wonderful. I have learned a lot from you today, and I wish you all the best for the future. God bless you and give you a wonderful journey forward.
Thank you. It's been a pleasure. Thank you so much for having me. Thank you. Bye-bye.
Wow, what an amazing conversation. I did not realize this before this conversation. What is the contribution of the professionals working in public health? And suddenly I just feel that we are blessed to be able to work and develop our skills at this level. So cool, right? Also, I love the concept of entrepreneurship. Resonated strongly by Miss Umembu. The idea that you can be an entrepreneur within an organization by finding innovative solutions to problems. Her advice to start and do it scared is also a powerful message for anyone considering a career in public health entrepreneurship. And if you wish to know more such strategies, go and order your copy of the book Public Health Entrepreneurship Navigating the Intersection of Purpose and Profit. To our listeners, we hope you found this discussion as valuable as we did. Remember, whether you are an aspiring entrepreneur or a seasoned public health professional, there is always something new to learn and innovative ways to make a difference. Thank you once again, Ms. Quisha, for sharing your experiences and wisdom. We wish you continued success in your endeavors.